Director General of the Africa Centres for Diseases Control and Prevention. Very good to talk to you today. There has been this spread in Africa that you have been monitoring. Why did you declare it, first of all, a continental emergency?
Thank you, Jen, for having me. Mpox is today a major concern for our continent. As you know, on the 13th of August, Africa CDC, following the advice from senior public health experts who took time to analyze data, who took time to analyze evidence. Let me give you some of the evidence. Today, you are right to say 15,000, but that one was last week. This week, we moved from 15 to 17,000 suspected cases. We moved from 470 deaths to 571 deaths. And that one is affecting currently 16 countries in Africa. We have three new countries that were added since last week. And we said, based on the fact that the outbreak is growing, is spreading in many countries, even non-endemic countries. For the first time, we have countries like Ivory Coast, Kenya, Rwanda, Burundi, Uganda reporting cases. We took our responsibility to say we need to declare this public health emergency of continental security to better protect and support our countries. And we were supported yesterday by WHO by declaring the public health emergency of international concern.
And what difference does it make that the World Health Organization has said it is a matter of a global health emergency now?
As you know, in Africa, the mandate to declare such a state of emergency is under Africa CDC. But at international level, at global level, this is the mandate of WHO. The main reason Africa CDC declared that is because we see the increase of cases and we see many countries affected in Africa. But the main reason WHO is declaring that is because it seems like we have so many outbreaks in one outbreak. It means Mpox is coming with so many clades, what we call the sub type of the virus. And also, we have some countries in the world reporting some cases. And WHO wants to avoid spreading the outbreak in other continents. Let me tell you that Mpox is one of the countries that WHO is considering as potentially the outbreak that can become a pandemic. This is why we are taking it seriously.
Why do you think we are seeing this spread now?
This spread now in Africa, it's almost across all regions of Africa. If we compile the data from 2023 to 2024, all 5 regions of Africa were affected. Currently, for 2024, we have only 4 regions. The North Africa is not reporting cases, but this is something that can happen very soon.
Why do you think it's the young who seem to be most affected? We were saying that under 15s particularly are suffering.
This is also something that is making us a little bit confused because the epidemiology of Mpox is changing. We have different figures from different countries, and even in one country, we have different figures if we consider different regions. Like in DRC currently, more than 70% of cases are young people. But you'll see in other countries, we have more adults. Now, having a virus that is giving us some issues in terms of epidemiology, we really need to conduct more studies by being careful. And this is why WHO and Africa CDC, we all agree that let us stop and take appropriate action. I will add something. In 2022, Mpox was declared public health emergency of international concern when we had many cases in Europe. Vaccine was made available in Europe. Lab tests were made available in Europe, even therapeutics. No one gave even one dose to Africa. This is why today, by taking this action, we as Africans, we decide to take the lead for our health and our well-being.
And how quickly, Dr. Kaseya, do you think you can get large numbers of vaccines into these areas where it appears to be spreading?
Let me share also good news. The first news I want to share, yesterday I finalized an agreement with European Union and Bavaria Nordic to provide 215,000 doses to Africa. My key priority will be countries like DRC, South Africa, Rwanda, Burundi, and other countries affected. But we know this number of doses will not be sufficient for Africa. We are targeting 10 million doses. These 10 million doses, we already started to finalize negotiation. And I'm in Angola today to meet the president of Angola. Tomorrow I'm meeting other head of state to see how quickly we can come together to sign the deal for the 10 million. The good news is we managed to fund the 10 million and Africa Cities will make this 10 million available for all countries very soon.